Hello and welcome to this special coverage. Well, at a time when the national capital, New Delhi, and adjoining areas continue to bear the brunt of the pandemic, a noble initiative by an NGO called Helping Hands is coming to the rescue of people of the Northeast, the Northeastern residents who are settled in NCR in New Delhi. The NGO, founded by Special Commissioner Delhi Police Robin Hebu, continues to provide something called Oxygen ATM service to residents of Northeast states who are in dire need of it. Not only this, Helping Hands volunteers are also providing essentials to the needy besides volunteering to perform the last rites and burials of COVID victims. A very noble initiative indeed. To know more on this, we are being joined by the man himself, Mr. Robin Hebu from New Delhi. Robin Hebu, Special Commissioner, Delhi Police, the brain behind Helping Hands. Welcome, Mr. Hebu, to the show. Sir, tell us more about this noble initiative by Helping Hands, the Oxygen ATM initiative for residents of Northeast, for Northeasterners in Delhi, NCR. How challenging was it to come up with something like this, and how do people avail this facility?
Look, well, there was a massive oxygen crisis in Delhi. So those notice COVID patients who were home quarantined and their oxygen level, many of them, they went down below 92, which is very dangerous for their health. So all of them were finding no alternative. No, there was no oxygen around, all around. They tried a level best by all means. So ultimately, they reach out to us, please do something so that at least we can issue a supply of oxygen to our noticed people who are quarantined in Delhi, NCR region. So as a result, after brainstorming discussion, we started this oxygen ATM. This is only of its kind I think, in the country, where we started collecting the oxygen from all sources, including from outside Delhi. We have storage in the Subhas Nagar in West Delhi. And thereafter, we had what is called informed to all our notice COVID patients through our NGOs, through our contact, through our community organizations, that if anyone from the Northeast who is having a dangerous oxygen level below 92, they can avail our oxygen, which we have managed from beg, borrow, and steal. And somehow it will reach out to our people. It becomes very popular, and we had arranged even with one ambulance to deliver even in the middle of the night. What this is, Oxygen ATM is, it is run by the NGO, Helping Hand, with the volunteers from the sick youth. Then we have a 24/7 mobile number. Anyone who is in need of the oxygen, they can send a call or WhatsApp the detail of the name of the patient, address, and the medical report of the COVID or the quarantine paper which doctor is given to them. So once we get that, we allocate digitally the number for the issue of the oxygen to this particular patient. And they have two choices. If they have an oxygen cylinder, they can come and take the oxygen. And even during the lockdown time, by showing the digital allotted number for the oxygen, even police will not stop them on the way. So we issue them those who are having a oxygen empty cylinder. And that also we give it for 4 or 5 days so that by that time the oxygen level improve. That is one. And those who do not have the oxygen cylinder, what do? We have some reserve of our oxygen cylinder. We issue them on the case of by seeing the merit as well as the emergency case of the patient. Then third option, we issue them that oxygen cylinder, and they return back after once they used it for 3 or 4 days after the oxygen is used. The third option, we have got an oxygen kit, which we got it from UP Meerut. We collected it we bought it from there. And this one we give it to them, those who are in I would say they are not in a dangerous positions, and we give it to them. And this oxygen ATM, which we have added, another one is that anyone apart from the oxygen, if anyone is in need of some medicines or in emergency consultation in the middle of the night. So what we did for that, we have a tie-up with some of the Gurudwara in Punjab, get the medicines, deliver them in the home. That is number 2. Number 3, if anyone from the Northeast, if they are not in hospital, you must make it very clear, it's not for the hospitalized patient, it's for those who are home quarantine. So for those who are in the home quarantine, if they have any issue, they want to consult to the doctors. We have our special 5 doctors from Delhi, Dr. Lira, Dr. Suman, Dr. Amit, Dr. Kaling Jamo. All of them are available 24 into 7. We have got 3 lady doctors and 2 male members. So they give consultation on how to proceed if there is any complication, so on and so forth. And on their advice, if the situation, I mean to say the patient's case, the what is called health deteriorates, then we assist them to get either in quarantine center where group quarantines where you have the better medical facilities, or even we help them to get a medical seat, hospital seat in the hospitals or around Delhi and NCR. Then apart from that, what we do, then we have one counselor. Many a time what is happening is now a lot of people that they are reaching out to us, they are mentally disturbed, having a depression mind, and what you have seen even in a Guwahati recent, one patient jumped from the top, died. Even in Delhi, so many, we have at least 17 cases of such cases where they were not a COVID patient, but they were depressed. So we need a counseling. So that we have a counselor. That lady has done an excellent job counseling to our people. And these 4 doctors are from the Northeast. Then these doctors, not only for the COVID, because of the COVID lockdown, now many people are not able to go to the hospital because all focus is on COVID and hospital is overcrowded. All of focus is only on the COVID. So other diseases are more or less, inadvertently, they are not taken care, and that becomes more difficulty, especially in the night time. So what we have done, this 5 team of doctors, we used to consult them medical, what is called by a video call, by WhatsApp call, give them even prescribe medicines, and if there's no one, even we deliver them in their home. Now I remember even last week, one Professor Buyam from Guwahati University, his daughter was lonely in Safdarjung. We just somehow managed in this way and help her to get the other medicines. So this is our humanitarian reach out to our Northeast people in Delhi, so that in this emergency crisis, as a last resort to save them from death during this COVID pandemic.
Mr. Hibu, apart from the oxygen ATM, your team of volunteers is also delivering essentials and, more importantly, assisting in performing last rites of COVID victims, burials of COVID victims. These are very testing times indeed. How challenging is it to drive something like this at the moment?
Goswami, I want to add you, in addition, what we have asked me the first time. We have reached out to 175 patients so far. Of course, SOS patient, that is for the oxygen and others. We could save many. Of course, many have died also. That is a different issue. That is one. And number 2, regarding this burial, yes, in this ATM oxygen, we inform to our community through our contact to the social media, through their community leaders, through their student unions, even through the employee associations, that there has been many deaths in Delhi and NCR. I know there are many. If I go on narrate, it will take a long time to cut it short. Many a time, what is problem is in the Delhi NCR is that those who die in a big hospital, they have an elaborate system of ambulance to carry the dead body. They have a whole sanitized medical team with the PP kit, head them to either to the crematorium or to the burial grounds for the religious last rite, as per SOP of the hospital concern of that particular hospital. So our role is very limited. Of course, they inform us. What we do is that in a hospital, when such death happen, then we request the family members, 3 of the family members, to accompany them so that they can have a last glimpse of their funeral or burial or the cremation. That is for the formal hospital. Those who are having those are admitted, lucky enough to get admitted in a big hospital, and unfortunately, if they die, for that, no issue. Problem comes, Goswami, is that it's a very sad and pathetic is that those people, thousands who are home quarantined or in some small hospital where they home quarantine, there's no question. If they die, then there's no one. Of course, we chip in. That is different issue. Even in a small hospital, they don't have that facility for carrying the dead body to the burial ground or to the crematorium. So, like just last week, one brigadier, his friend died in DROD quarantine in Delhi camp. So his body was lying for 2 days. So they tried to book it to in the Nigamgod, the waiting list 147. So it would take another 2 days to bury. So what is we did that somehow we chip in. And before I go further, I want to tell you that after seeing this, all this chaotic and requests from SOS from all the people who have died from Manipur, from Assam, from Sikkim, and all other states, what we did is that we scout out and we, in collaboration with the United Sikh, which is a very vibrant organization of the Sikh youth, who they have an ambulance for carrying dead body. They have a team led by Devinder Pal Singh and Manjit Singh. They have been with us with helping him even earlier also, but this time because of the large number of the death, they have specially committed that the burial preference will be given to us. So we have a collaboration with this United Sikh. So if any notice patient who dies out of COVID or even non-COVID in Delhi and around Delhi NCR, we make sure that immediately their dead body is taken care, and this Sikh youth, along with our volunteer, they are having PP kit, take them around, and we have our already, as earlier in helping hand, as already tie up with the Punjabi crematorium, the Punjabi Bagh crematorium for Hindus, those who are the last rite, it is being done there. And for Christian and Muslim, we have the graveyard in the Dwarka sector 23 of the southwest Delhi. We have the graveyard in the Purari, even in the Mongolpuri. So that's how we help them out, give them those coffin, and make sure that the decent burial is given, and we take their family member and reassure them. So this is one of the, I would say, a very, very risky, but we feel privileged to at least to give the last journey of the
Indeed,
dead patient.
indeed.
So,
We are also joined by Dr. Sangeeta Datta from Guwahati at this moment. Dr. Sangeeta Datta, psychiatrist. Dr. Datta, we are in conversation with Mr. Robin Hibu, Special Commissioner, New Delhi. Mr. Robin Hibu has indeed undertaken a very noble initiative through his NGO Helping Hands, that of what we call an oxygen ATM service. Besides, his volunteers are also delivering essentials to the needy, assisting in performing of last rites, burial of those who have nobody to fend for. Indeed, it is these COVID Samaritans who have come out to give a hope, a ray of hope during these times. Wouldn't you think so, Dr. Datta?
Absolutely. I completely agree. This is a commendable job. In fact, everyone, we are so grateful to Samaritans like this, Good Samaritans, who have actually come out with, they have actually done their bit, and they have gone beyond what can be usually done during such a pandemic. So a salute to you, sir. Yeah, that's an incredible job.
Absolutely.
Yes.
Mr. Hibu, some may say, why a facility, why a service only for those from the Northeast? But what we get to know is that your team has helped everyone from NCR, Delhi, as and when needed, isn't it?
exactly. I always tell this word, even in a family, if one of your brother or sister is the most weakest, and if you just little give more preferential treatment, I think one should not take it as a discrimination. So of course you are right. He said even during the ration distributions, even now also we are not only for the Northeast, of course maximum are from the Northeast, because Goswami, you must understand one point very clearly: the vulnerability of the Northeast people, Northeast especially the patients in the cities like Delhi and NC are very, very, I would say, pathetic. Why I'm telling you? Number one, if any Haryanvi or Punjabi or any community from the Delhi, if they fall sick, there are hundreds and there are so many of the community organizations. They chip in within no time. They have all the well-organized system with kit and keen. It's their hometown. They're well connected. But our Northeast people, we have a very few organizations. In fact, it won't be out of context to say that only they are reaching out, only the visible and approachable NGO is only Helping Hand. I shouldn't say it, but it's a fact. We have thousands of calls for last 1 week. So that's how this vulnerability it increased more. हमारा कोई नहीं है यहाँ पे. kahan jaye? If somebody from mainland happened, then there are many other sanstha. That is one. And number two, most of the people from the northeast generally they can speak proper Hindi. So as a result, जब आप hospital में जाते हैं कहीं भी जब in this emergency crisis, nobody has got patience to hear your broken Hindi. So also language barrier also create further more hindrance to avail the facilities what we are having. And third point, if you are in a distress, if you need medicine, if you need what is called any other support from us, they have no other option other than dialing to the helping hand. So there's whereas in others they have so many sanstha these days because I'm in Delhi for last 18 years as a DCP now as in a higher rank. So I know they have a huge plethora of NGOs for the different community of the mainland in Delhi. But for the people from hills like from Northeast, from Ladakh, from Assam, from Northeast, except for helping hand, even though we have a Bhavan, but they themselves are not, unfortunately, because of the reason they too are also best region known to them. They are not able to reach out to them for some way or other. So that's what I'm telling you. This is not a discrimination. This is not only for the Northeast. Yes, we are there, but we cater to the most vulnerable, helpless, who are lonely sitting in some corner, working in an unorganized sector, getting just peanut salary. They are not able to pay even the house rent. So I hope you can understand the problem. That's what I always say.
Yes.
Those who are sitting in the back home, you tend to forget our Northeast brothers and sisters who are struggling in cities. Nobody talks about them. Nobody even bothered about them. So I was feeling very greatly encouraged when Mary Kom called me up. She gave me 3 lakhs rupees and many more. They are, by contributing from their own pocket. Even I started this oxygen ATM by 50,000 from my salary. So what I want to tell you that it's very easy to say from outside from Delhi, you are only looking after Northeast, why you are only for this and that. But problem here on the ground is a very, very serious, and many a time we have no one to look forward with tears in their mind. So that's what we are for everybody. But yes, we are for the most vulnerable people from the Northeast.
Very, very well put, Mr. Robin Hibu. More power to you, more strength to you. Well, for this noble initiative, so many benefited, hundreds of people benefited, and it indeed takes a lot to carry out something like this during this time of crisis. Thank you so much for sparing your valuable time and giving us all those inputs. I'm sure a lot of people will use the services of the Oxygen ATM, and of course will use the services of Helping Hands volunteers who are relentlessly, selflessly extending the helping hand to all those needy. Dr. Sangeeta Datta, again, that brings us to a point once again, as it is, people from the Northeast feel a bit vulnerable outside the region, and these are very testing times. Very important that there's support from back home, because depression, as we know, is a bigger killer than probably even the pandemic.
Yes, but we must remember one thing here, that during these times of, that is the second wave that I'm talking about, where we are seeing very many people die in front of our eyes. I think the mortality rate has been really high, more than we can imagine. And in such times, life is a priority, because earlier, it was, we are talking about things like, once the pandemic is over, perhaps mental health issues will be the second pandemic. And we are sure it will be, because a lot of people have lost their lives. A lot of people have actually fallen sick. They have lost their jobs. There is economic crisis. People are, in the midst of uncertainties. Children are at home somewhere, there have been a lot of psychological issues like depression, anxiety, then psychosis, obsessive compulsive disorder, substance abuse disorder, increased suicide rate, and this has affected every age group. It is not just the adults, the children have been affected. On top of that, other psychological disorders, like we call it infodemic, because the people are watching a lot of news these days. So they're overwhelmed by the information that they get in news about regarding COVID-19. So they're suffering from increased stress. We have something called nomophobia, which it was there earlier also. Like, people can't do without the mobile phone. So they become very anxious if the mobile phone is taken away from them. They feel isolated. They feel as if they're lost. We have something called game addiction these days. It was there earlier. Now it has worsened because, children who are now can access the smartphone because they have to do online classes. They're abusing the smartphones and the internet services. So there is internet addiction. There is game addiction at at a much higher rate. It has increased than we could have expected or imagined. With all these coming in, we can definitely imagine that during this pandemic, as well as during times maybe after 6 months when the wave gradually wanes, it comes down, mental health issues will be a bigger pandemic, and it is still a pandemic also parallelly happening. However, having said that, we cannot
Also,
forget that this
also,
time.
also, can we say the second wave is worse when we talk about mental well-being, mental health? The second wave is perhaps worse than the first because the fatigue was already there, and then you have
Yes.
more to handle.
Yes, absolutely. Absolutely. Because, earlier, see, in the last, 100 years or so, we haven't seen something like this. At least in our lifetimes, we have just read about pandemics. And now we are seeing this. What happened last year with the first wave is that people were still hopeful. Well, this has come. They were not prepared. They were learning new things. Yet they were hopeful that this is going to end. Now, and we had actually accepted something called a new normal. Gradually life was getting back into the so-called old normal. We had about 4 5 months back, we were almost living normal lives, just following the protocol, COVID protocol. However, and again the second wave hit us. Now the state of the mindset of most of the people is like this, that we don't know, maybe a third wave comes. We don't even know if we are going to survive this second wave because the death rate is so high. Every now and then people are hearing of deaths. Just today, I came across a news item where I became aware of the fact that today it's the highest death rates reported in India. I think it's more than 4,500, which is a very alarming number. So all these things are making everyone, including me, very anxious. Though I'm a mental health professional, yet I'm aware of the fact that the second wave has been a bigger blow to our mental health than the first wave. We are also exhausted, as you said, because our resources have been totally exhausted now, mental resources, financial resources, other resources. And nowadays, when you tell
Sorry to
people.
interrupt you there. On one hand, we have the pandemic that we are fighting. On the other, of course, lockdown is a necessity. Curfew, extended containment measures are a must. The governments, authorities can't avoid them. But at the same time, that also impacts livelihood, that impacts the economy. So it's a two-pronged battle that we are fighting once again, and we didn't
Yes,
expect it again. Does that really add on to the pressure? And would the
absolutely.
mantra be to try and hang on somehow? I mean, it's easy for us to say, but would the mantra be to try and hang on, hold on for a month or so, probably, and see if things improve, and then maybe things can take off? Probably there is something every Indian has to tell himself or herself at this moment, isn't it?
I think if you talk about the mantra, it will be a few things, not just one thing. First, we have to clearly understand in this situation of crisis, what is within our control and what is beyond our control. We must not try to control the things that is beyond our control, but let's at least do things that is within our control. Number one is following the protocol. All of us have been repeatedly saying that: wearing a mask properly, covering your nose and your mouth, maintaining social distance, and sanitizing your hands repeatedly or cleaning your hands. Number two is getting yourself vaccinated with a 2 dosage of vaccine. Again, there is a scarcity of vaccine. That is another issue, which is leading to a lot of panic these days. So I hope the government is going to attend to, is going to solve this problem, because that is of utmost priority. I think that is very important now. Number three is, it is not just following the protocol by yourself. Even if you see someone else not following the guidelines, please make them aware and insist that they follow the protocol. And I think every individual, the government, the NGOs, and everybody does their bit to be able to control this pandemic. And this is going to last for the next few months. If we look at the normal history of a pandemic, or the normal course of a pandemic, if we read even community medicine or anything like that. So it is going to last for the next few months, but we still can control a few things. We can still follow the protocol. We can get ourselves vaccinated. We can stay home as much as
Definitely,
possible.
definitely.
And
We
more
hope
importantly,
with
keep yourself positive, please, because it is your positive mindset which is going to also decides your level of immunity, along with a healthy nutrition nutritious diet, regular exercise, adequate amount of sleep, 7 to 8 hours, yoga, meditation, thinking positive, keeping yourself positive will be very important. Indulging in hobbies will be
Absolutely. A
very
tough
important,
ask, a
because that
tough
way you
ask.
are
A
better to
tough
fight.
ask,
You are
but
in a better
yes,
position
a
to
tough
fight.
ask, but yes. And we can only hope the ongoing restrictions, the lockdown, the containment measures, the extended curfew hours will be
Yes.
successful in breaking the chain to an extent. Probably by July, maybe some sort of normal may return. That's what we can all hope for. Thank you so much, Dr. Sangeeta Datta, for your valuable inputs. That's a wrap of this show.